Hello there, I'm Miranda Gretton and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment. In this episode, Clinical Operations Manager Laura Palmer tells us about her experience of being a line manager to staff experiencing the menopause and what the Trust has done to support her in supporting them.
When I came into a line management position, I've been lucky enough to be part of the health and wellbeing group for the Trust. I'm very much aware of the work that we were trying to do on the menopause, which, as I say, I felt gave me a little bit of a head start. And also, I have a very close relationship with my own mother. She turned 50 and things had started to change. I had to start saying to my own mum, you've told me that a few times now. And it's that conversation, that awareness. And I think it's a subject, it's a bit of a taboo we don't talk about. I'm politely quite a bit younger, and I'm even at that stage where people don't talk about other things such as fertility and children and things like that. And I think it's one of those subjects again that we just seem to shut away and don't want to talk about, though it happens to 50% of the population, which is just ridiculous. So coming into line management at a team and finding a colleague that was and having quite significant potentially symptoms and effects from it, I thought, right, here we are. I've got a chance to really try and understand this more than just reading about it or discussing it with colleagues. I've got a chance to help someone here. And things that I could think about was what the Trust were talking about in terms of our flexible and work-life balance policy. It doesn't have to be set and structured now, and we could make that work for my colleague to help manage this, because this politely also isn't going to be long term. Things hopefully are going to improve, but also things are very variable. And that's what managers have to remember. How a colleague feels one week might be very different the next month, for example. And that's what we've got to think about. So knowing there was resources out there, things that I could direct my colleague to, some of the resources are out there from various different authors, and such as we've used Hempicked, I know, as our provider as well to support us within the organisation with such a raft of information. I think it's really good. In the NHS, what is it? I don't know the exact figures, but the amount of women, again, who work for the NHS, I do believe is much higher than males. So again, why is this not a topic that we should really, especially as managers, be really hot on it, essentially? And it's not just politely about the fans and a lightweight uniform. That's a tiny proportion. It's everything else that goes along with it. And then in a community trust, let's be really specific about the role we do. A lot of our staff are out there driving. We're covering the 4th largest county in the UK. I just know getting from meeting to meeting or going around, that can be really tiring, let alone going through the menopause, at the same time as that. So it's thinking about other things that are going to affect our colleagues and making sure there's a plan in place, and also that's that acceptance. I have to say I'm in a team at the moment, and I would say we're predominantly, if not I think nearly all, 90% female, and actually probably, if we looked at our average age, is probably 40 plus anyway. So it's a topic we are all discussing openly, whether we're talking about who's on HRT, what my brain today, or that's the menopause. But we shouldn't just shrug that off and feel like we're definitely trying to progress the conversation. And I think even as managers, we can share our experiences as well, going through that very confidentially, of course. But have you it's that conversation, well, have you thought, could this be happening to this member of staff? And I had to do this where we've changed hours for 3 months and we're going to review it again, because I think that's really important to support colleagues and to signpost them as well. Some people's, I'll be polite, but some people's GPs will be more clued up than others. Of course they will. I appreciate they have got an array of topics to have and understand. But even if you've got nuggets of information, I only do that from, I'm sure my mum wouldn't mind talking about, a private clinic that she has been to, and friends and family have looked into, and just, some of the information you can gather from there, or support groups and things, like even the more productive things online about things that could support and help you, I think is really useful to share. And especially, as a young manager, or I'd even say, not to scrutinise or discriminate, but even like a male manager as well, just to have that understanding. It's challenging, but it's a topic that we all need to hot up on, I guess, really, because it's really relevant, and it's something that just needs to be discussed as much as I've got a cough or a cold or anything else. It's I'm going through the menopause, and actually this month this is what I'm experiencing, and I'd hope that any of my staff could come and talk to me about that. I'm not saying I'm an expert, but actually it's really positive the trust is starting to even get some of that more specialist knowledge into the organisation.
Thank you. That's so interesting. And I think you're absolutely right. As somebody who's a bit younger, or if you're a man, like, you might not necessarily think this is something you need to be worrying about, but it's so important given, like you say, our workforce from sort of like a management perspective. Do you think there's anything else that the trust could be doing to support our colleagues?
Like anything, I'm really I'm conscious there is so much for, like, I feel like a GP actually. There's probably so much for us to know about as managers. If that anything from, we've got a member of staff having mental health problems, is that something, menopause, a bereavement, gosh, there is so, I have to feel like I have to be an MSK expert, and lucky I'm a physio, so I'm aware of that. But we have to be aware of so many different things that it's quite challenging, and I'm looking forward to, if the trust are able to do their health and wellbeing days for training for managers. I think that would be really important, just so you have that awareness, because I'm a manager who tries every week to scan through weekly messages to see what's there to support my colleagues, essentially, for me to be a better manager, to me to be a better leader. And I think being a leader is about knowledge, and is therefore to be able to empower my colleagues. So I guess that time and space for managers to do that would be, really useful with the pressures we're under. But it goes back to, if we aren't able to support our colleagues, our teams, they're not therefore going to be then able to be out there seeing the patients that we need them to see. So it's that knock-on effect. So I'm all for, if the trust are able to, to progress that, and that to happen even next year, I think would be a really great step forward for the organisation. I think that would put us really at the forefront of supporting staff. So I think what's really positive is now that we have 3 sort of, I'm not calling them champions, but menopause experts, haven't we, that have been trained from a leading provider that is handpicked, and just their availability, and to be able to discuss, with staff. So for staff to maybe be able to contact them quite easily and available, I think would be a really great step forward. But I do think we're starting to make inroads into a topic that I think will be is really valuable. As a line manager, I'd just say, don't beat yourself up. We can't be an expert in absolutely everything, and there is things out there if we look for them. So the guidance on menopause in the workplace that NCH&C has put together is really useful, and as a starter for someone who maybe's got no experience in this, either personally, professionally, that's somewhere to start. It's only from things that I'd read or seen online. I've seen handpicked a lot. Great to look at their website, and I was aware of places like Newson's Health Menopause and Wellbeing Centre, just from friends and family. So it's just broaden your horizons. Again, you can't be an expert, is all I wanted to say, but there's lots out there to support you. And things like occupational health, because we, as I say, that we can't know everything, and it's good to have that advice, and that's something that's worked for me and a colleague, and something I'm also conscious of with managing others in the future, just to have that bit of awareness, and just to also say to people, so what are you experiencing, because it's not all go back to it, it's not all the hot flushes and needing fans. That's a minor part of it. So just look out for the resources that are there, and talk to one another, talk to other line managers, and if you learn something, I think the key thing is to share because that empowers us all, and that can sort of spread this sort of cascade of, I guess, knowledge across this organisation to make us even more supportive than I think we already are as an organisation for staff.
Thank you so much for joining me to talk about this. I think it is such an important topic, and we just need to keep talking, don't we?
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.